Hello and welcome back once again to the village. I am your host, I guess, or leader, Thelma, and I am so excited to once again come on here and just share some words of wisdom and be here with you guys and hear stories and things like that. So, thank you again for liking, subscribing, and joining us in this movement here at the village. And the support has been phenomenal. Um, Thank you so much, family and friends that have supported me in this journey. And once again, we're going to get right into it and talk about three important things that I believed really helped me in my journey through and parenthood when it came to my child's diagnosis, all of my children's diagnosis, but really the very first one, um, our Jacob, where he has an autism diagnosis. So just gonna jump right in to this, kind of picking up where we left off last time and the what now, or my child has what. But this is the part two, pretty much into that, is what now. Um, you have the diagnosis now as far as your child goes. You have focused on self care. You have focused on getting care for your situation as far as the support system, case management, any resources in your community that are available to you in aiding you in your services for your child, early intervention services, speech, physical therapy, occupational therapy, you pretty much name it, musical therapy. There's all different types of therapies out there now involving in the help of children with disabilities. So I'm super excited about that. We've gotten lots of information for that sort of thing, and I could not be happier in regards to how well this channel is being received and it's being shared, not just here, but Facebook. So proud of you guys. I'm so excited. The emails, thank you, thank you, thank you, thank you, thank you. We love you. We want to keep this up. We want to keep this going. But now we're going to jump right into it. So, of course, your child has a diagnosis. And you've gone over some steps in regards to getting yourself some therapy, some help, talking to somebody, establishing some health routines for yourself. All of that is going to be key in your journey. You're going to hear the word new normal because it is pretty much going to be fairly new and something you're going to have to get used to, you and your family, in regards to when anyone kind of gets ill or struggles with something that is just pretty much outside of the normal. So one key thing that we talked about is self-care, establishing a support system, and educating yourself, becoming an expert on your kid's diagnosis, and not just becoming an expert for yourself, but also for your family members, your community. That step is also empowering. Once you become educated, you become empowered. That is so key. You now have the tools that can equip you to best handle what's coming next, whether it be in your marriage and getting support from a support group where you both have to kind of figure out how to balance uh, therapies and finances, and is one parent going to stay home while the other parent works, because we have to balance child care and different things like that, it gets very difficult. It becomes very life altering and life changing. So, educating yourself, so important. That way you can feel empowered, and together you can make those changes, getting your family involved. And once again, that's why we're here. We've all, most of us, have gone through these type of situations. Some of us are just now stepping into. We have some seasoned villagers. We have some in the middle villager like me, and then you have you guys that are just beginning to walk this walk. And again, we are wanting to be here for you and give you the right resources because you are not alone. Which brings us to our segment, What Now? And it's very broad, it's very huge, but we are going to break this down pretty much step by step and kind of go over what it is that you have to do right now. And so far, if you're following steps from the first video, you're doing great. You, you're doing great, and continue to do great, because it's what's going to keep you grounded. It's what's going to keep you sane. It's what's going to keep you focused on what's important. It is very easy to slip into the negative side and focus on the negative, and not to disregard what anybody's feeling, because it is pretty hard to go through things when your family's suffering, or it's hard to kind of manage and keep your head up when you're not feeling the greatest. And there'll be days where you're going to most definitely win and feel good and ring that bell, and then there's going to be days where you don't win, you lose, you feel fatigued, you feel tired, you feel mentally exhausted. You might go and see your therapist, and some may recommend medication or things like that to kind of help with the anxiety and different things. And I say it's completely up to you. Do what you know is best, and discuss these things with your family and with your therapist. As I said, I'm no clinical therapist, doctor, or anything like that, but I am a mom, and I have been in this for 10 years, and I've gone down the path of where I've had to take medication for some of the anxiety and different things that I was feeling. I was not able to really stay on them long, the different medications, because it just made me kind of slow down. Prime example, I was in bed knowing that I needed to get up, and in my mind I could see myself getting up, but I couldn't move. So and I had kids to take care of and make sure they were fed and clothed and bathed and pull-ups and diapers changed. So I had to find a different method to deal with my stress and my anxiety and my mental anguish at the time. And one thing I can encourage you to do is be patient with yourself during this time period. Be patient with yourself. Be patient with your spouse or your significant other. Be patient with each other. It is so important, because everybody handles stress different. Everybody handles depression different. We all handle things differently, and it's at times like this where a lot of conversation is going to be, has the possibility to be open, and a lot of ideas get that opportunity to come out, and it's a beautiful thing. It's a really neat thing. So the biggest thing in the topic of today is MVP. And when I talk about being the MVP, it is exactly what it is. You are the most valuable player in your child's team of experts. We talked about becoming an expert on your child's diagnosis. You are the MVP. You will be the most valuable player on that team. There could be doctors, specialists, teachers, but you are the most valuable because you are waking up, you are showing up, you have all the information. You have all the key information to give to the specialist in order for them to work out treatment plans for your child. In the academic world, treatment plan for a child with a disability goes along the lines of an IEP or the 50, yeah, one of those. My mind draws a blank. But from my experience, my child has an IEP. All of my kids have IEPs, and that is an acronym for Individual Educational Plan. At least that's what I think it is. And it's a plan that is specifically built for them to accomplish educational goals to help get them to where they need to be academically, depending on the grade that they're in. So, this is a really cool thing that the schools offer. And once again, get into the schools, become very familiar with your kids' teachers, the nurse, the whole team of experts surrounding your child. Get to know them, be able to ask them questions. Don't feel foolish about asking questions. This is the time. This is the time to ask questions, and there are no dumb questions. Um, because your child is going to get the best care when you are aware. And I just made that up, sort of, kind of, but it's true. Your child is going to get the best care when you are aware. So when you know better, you can do better. And that is our goal, is to educate each other and how to know this information, to be knowledgeable about what our children are doing, what they are learning, their strengths, their weaknesses, and being able to learn different terms and the terminology when it comes out to their diagnosis. For example, expressive and receptive language disorder and or delay. I did not know what that meant. I didn't even know that existed. However, with all of my children, they struggle with speaking. They struggle with understanding my speech. So when it comes to following 2 and 3 step instructions, they would hear the first thing I said, hear the second thing I said, hear the third thing I said, but then only do the third thing I said. They completely will forget about the first and the second thing I told them. And a lot of times this could be normal kid stuff, but as your kids grow up, you begin to notice that, okay, they need constant reminders. And so my experience with my children, I had posters everywhere. We developed flashcards everywhere. We were able to give visuals, lots of visuals and cues to let them know where their coats go, where their shoes go, and all that sort of thing. And this will become a part of that phrase I told you about, new normal. It will be difficult. It will be challenging. At times you will feel like your house has turned into a kindergarten classroom. And if you, like me, don't mind, I make my home a kid-friendly zone, because I'm pretty sure that all of my wonderful ideas of decorating and things like that, they're going to be for a later time, because the kids are going to be kids. They're going to get things messy, get things dirty, spill juice. It's going to happen, special needs or not. It's going to happen. And the best thing for me was to just create a space for my kids to feel comfortable and free, and use it as a teaching area, a teaching ground. So when they would make messes, I would most definitely come alongside and say, oh, we made a mess, and let's clean it up, and not have to be almost cringing because it's a brand new couch, or something that's really nice and fancy that should not have gotten dirty or destroyed. So being patient with our children is going to be key in this what now factor area mindset. It is kind of getting into that phase and mode of, okay, this is what I call discovery mode, where you are allowing your child, humbling yourself and allowing your child to show you who they are, show you how they learn, show you how they kind of interpret their environment. And it's a beautiful thing to watch. It's a very amazing time in their lives. And you're going to see so much growth. You're going to learn so much patience with them. And then also, the more you're patient with them, the more they're going to be patient with others. I remember getting so many compliments on how loving and affectionate and warm my children were, or they still are, Jacob mainly, because he prefers adult attention, and he prefers someone just to be able to know what he wants. He seeks out the alpha in any situation. He wants to be able to know who he needs to go to get a juice box, and he does. If he can't get it himself, because now he's at the age where he'll go get stuff himself, and you'll have those. But the most important thing, of course, in this time is continuing steps 1, 2, and 3. That is self-care, going to get massages, going to get your hair done, developing a spa day, setting time to take time to remove extra stressors out of your life. Extra stressors, extra drama, anything that's extra, it's got to go. If not, you're going to find yourself on blood pressure medication. You're going to find yourself on all types of medication. Even when you get on medication, it's not going to work because the stress is just there. And stress is a killer. We don't want that for you. So, biggest encouragement, find your happy space, your happy place. Continue to develop relationships with your case management team, the pharmacist, your primary care doctor, neurology, if you have to go see a neurologist, because in my experience, my son had to go see a neurologist because of the stimming and things like that. And you may notice certain things depending on the level of autism or the level of their disability. Some children have seizures, and it could be so scary. I've dealt with 1 or 2, sometimes some staring spells, and it is terrifying and it is traumatizing. As a parent, it's not easy. It's, parents, call me, we can talk. It is something to have to deal with. Feeling completely helpless in a situation where your child needs help the most is hard. So, yes, we can most definitely get you some resources in place where you can begin to address those traumatizing experiences and things like that, because you're going to need them. You're going to need the help. You're going to need the reminders. You're going to need some calming down techniques. It helped me in my experience. I was able to work well under pressure, because for a long time I could not, and I did not. And I had to learn to develop that skill when there's an emergency and my child needs me, not to freeze or allow yourself to feel, but then train yourself to act accordingly. So it's important. It's important. That self-care is so important. Putting that oxygen mask on first is so important. Finding ways to soothe yourself, finding ways to feel good about yourself or your situation, and rewarding yourself. One thing that was really huge for me was getting a YMCA membership. I got a Y membership, and I began to work out, and it began to help me process mentally, emotionally, and physically. I dropped 40 pounds in like 5 months. And I was just like, whoa. I just, kind of went to clean eating, also clean eating with the kids, just step by step, just beginning to want to be healthier and be in a better position to be there for my kids. And that empowered me to educate other families, other moms, as especially in my family, my friends who also have children with a disability and or special needs. And we began to talk and we began to go over certain things like this and put them in place. And we also developed a support group in which I would love to have one of the sisters from the church come on and talk with me in regards to how we developed a group where parents can come and receive help, support for their situation in regards to their children. We come together and let the kids have play dates. They come together and go on field trips together, bringing all the kids together, spending time with them, allowing them to learn each other and learn how to play with each other, learn how to have experiences just like children should. And that's what we started to do, and it grew, and it's a beautiful, beautiful program. If you would like some resources or information about it, just send me an email, thevillage419@gmail.com. I would love to get you the information over to the Family of Hidden Treasures Disability Awareness and Support Group over at City of Refuge Ministries in Toledo. We are amazing, and we would love to have you. So that is one of the most important things about the aftermath of it all. Now that you've received the initial diagnosis and you've gotten a chance to process it, giving yourself a chance to get some help and process with your family and develop a routine in regards to taking care of yourself, a routine in regards to taking care of the situation, and a routine where you are educating yourself, doing the research, and feeling empowered. Because the more knowledge you have, the better you're going to feel, and things will get better. They will get better, and it won't take forever. It will just small wins every day, little steps. It's going to be what, helps you get through, and celebrating and embracing those little steps, those small wins. I cannot stress enough how important they are and how good you're going to feel. So, once again, thank you so much for tuning in. Thank you so much for liking, sharing, and subscribing. We have a segment that we're going to be discussing come next week in regards to many of your stories and many of your questions. So I am looking forward to developing some Q&A type videos, and I look forward to answering many of your questions and getting resources out to you. And once again, if you have any information in regards to any services in the community, we would love to get that information from you, and we would like to share that information. We want to put it in our database. We want to let people know that, hey, if you're in this area or if you're in this county, this is something that has been brought to our attention. We want to make that connection. We want to continue to support people near and far, all over. Like I said, I don't know how big this is going to get, but to me, it's already big. It's already just touching me and blessing me, just being able to get this information out to you guys, or just allowing you to write in and just sharing and sharing your stories, sharing what's happening with your kids, sharing what little things you've noticed that are different and that are good, and what things you've noticed that are not so good and you want to see change brought to the medical system, the educational system, and by golly, there's lots of things that could be done better. And we're going to discuss those. So looking forward to putting together this Q&A. Continue to email us questions, concerns, whatever it is that your heart so desires. You just want to talk. Once again, just write to us. Send us your contact information, and we will be happy to get back with you and just bless you with some information and some encouragement. We're so excited about what we're doing here on this channel at the village. The villagers have spoken, and we are here and we're rallying together, and we're here for the greater good. We're here to love on our children, serve our children, and be the best parents we can possibly be. So again, write to us, like, share, subscribe. That's my thing. And continue to support the channel. Continue to spread the word. And soon, we would love to get some t-shirts made and some hats made. And we want to start a monthly giveaway. So that's going to be pretty exciting. Look forward to that. But, and anyways, love you guys. See you soon. And thanks for tuning in. Have a great day and a relaxing weekend if you can. And don't forget, please put yourself first. Got to put that oxygen mask on first. All right, guys. Have a good one.